I'm Athena Jezik, and today we're going to do just basic Swedish massage work on the model today, Karina. So we start by just applying the oil. You want to apply it fairly liberally, but not too much oil to make it too slippery, or too much oil to make it uncomfortable for the person. And be sure to get up into the neck. Again, when you apply the oil, be sure to put it into your hand first and rub your hands together. Spreading the oil on your hands and then spreading it on the person that you're working on. It makes a much nicer way of approaching the body. So I'm just going to go through my normal routine that I do. This is primarily for relaxation. Swedish massage typically will take care of some knot problems or muscular problems of an injury nature, but it's basically more for relaxation. So we just do the basic steps. Swedish massage has certain movements that it has, and that's what classifies it as Swedish. The effleurage and petrissage and kneading and tapotement is primarily the ones that we work with. I don't use much tapotement at all. I do use the other three. So this is an effleurage. A little more thumb iron. It's hard for me to go completely basic with the way I learned it in school because I've been practicing for so long that I have developed little extra things to put in it. And we'll start on this side of the back where you stretch to the trapezius muscle. All with those three or so techniques and a little bit of things added. Basically, you'll be able to just see how a relaxation massage looks. Pushing back up. Swedish massage is primarily for circulation, softening, and relaxing, which is why it's so good to do this on a regular basis. Maintain our stress levels, give the body a chance to take it into a deeper relaxation. Get circulation going in again. And we're coming down into the low back. This is a routine that I've developed over the years. It works good for me. It flows from one muscle group to another, which is a nice way to approach it if you're working on somebody. Do things in threes. This is more of a thumb iron, but it could be considered a little more Swedish work as well. Sometimes the terminologies get a little bit gray area because there's only so much you can do to manipulate a muscle, and people get sort of ridiculous sometimes about words and names, and they copyright the name, and somebody else can't really use the name, but they do the same technique. So it's really all in the hands and what you feel and how you present yourself through that sensation that you're feeling that really makes the difference. And then we do the same thing on the other side. Pulling that muscle, stretching that muscle, getting inside that muscle. Even with Swedish massage, you should not use a lot of pressure, deep pressure, unless that's what you're specifically going for. If it's a relaxation massage, it should be enough pressure that people feel it. It shouldn't be ticklish or real light, because then you're not going to get much result into the muscle. With a tickle kind of massage, lighter work is for lymphatic work or other techniques that don't require getting into the muscles for circulation. And then rolling down the back. I probably do my deepest work with Swedish technique, and even that isn't that deep. And again, it's because I have other skills that I've developed, so they blend together and make a very nice mix. Take the best out of each modality and work it from there. Back when I was at the peak of my massage work, I would do sometimes as many as 7 massages a day. And back then I worked 6 days a week. Usually I would only work 5 a day. So I had a lot of practice. That went on for many years. Now I do very little massage work. I do have clients that come in for massage, and I don't mind doing it. However, I prefer the other modalities. The cranial and the lymph are where I tend to do most of my work now. This has a little vibration to it, which is also a fun thing to do. Vibration feels real good, especially along the spine. And then, of course, the trick of a good massage is being sure that you get from the origins to the insertions of the muscle. So much of massage is done just in the belly or the body of the muscle. And although that feels good, the stress points are usually at the attachments, at the origins and insertions. That's where the muscles attach. The origin tends to be where it starts. The insertion is the movable side, if that's a movable muscle. And sometimes muscles will only show one side because you can't palpate all of them real deep, especially the deeper groups. So you get wherever you can find one end of the muscle or the other where it's attaching into the tendon and then into the bone. It's very helpful to be able to remember to go to the distance on the muscles. That's what also gives a feeling that the massage is a little more complete. when there has been time taken to go to origin and insertion. And then we'll just wrap her, pulling it upward. And then downward. And I'll show you this on the other side as well. And pulling it back down. And there is a short little example of a back Swedish relaxation massage. This is Athena Jezik. Thank you for watching.